Now we're quickly trying to look at clinical features of acute rheumatic fever. Acute rheumatic fever. All right. So basically, it's a complication of the heart, and it's coming from what? A sore throat infection that was neglected by the Group A Streptococcal. So over time, the organisms went into the blood, then they went to the heart. Okay, that's a bigger story around that. So clinical features, what will the patient complain of? So the patient will complain about so many things. So these things are divided into the major clinical features, or they say the major criteria. Then also they are also divided into the minor features. Okay, also the minor criteria. Now the good story about this is these two features, they help us in making diagnosis. All right, if you see so number of major criteria in a patient, it confirms the disease. Do you understand that kind of thing? So for the major clinical features, there's carditis, so inflammation of heart layers. It could be endocardium, it could be myocardium, it could be pericardium, anyone, or it could be all of them or two of them. Do you understand? So patients will be complaining about chest pain, okay, shortness of breath, heart murmur, okay. Then we have polyarthritis, okay. So there's a whole lot of inflammation in the joint, and it can inflame these joints. The other day to go to these joints, that's why we say migratory. It's moving from one place to another. The Sydenham Chorea, the person is just moving involuntary, affecting the face, hand, and feet. Erythema marginatum, you have a lot of patches on the skin and all of that. Then subcutaneous nodules. Okay. Then minor criteria. That's minor things you are basically able to pick up that are not specific. They can mean anything, right? We have fever, typically above 39 degrees. Arthralgia, that's joint pain because of the polyarthritis coming in. The elevated acute phase reactants, okay, erythrocyte sedimentation rate and the C-reactive protein. Then prolonged PR interval. Then also, if you do a culture, you are seeing the Group A Streptococcus in a culture of a sample. It could be saliva, it could be blood or so. So that's what we got.